So, doc, I've tried all those other techniques like cooling and all of that. They didn't really work well for me. Is there any medication out there for me, doc, that I can try? Of course, you've come to the right place. Many non hormonal therapies have been shown to help reduce the symptoms. There's one new drug that's called fezolinetan, 45 milligram, you can daily. It's been shown to reduce the symptoms. There's also a medication that long time ago it was used for depression. It's called Paxil. As a dose of 7.5 milligram daily. Both of these is FDA approved to help reduce vasomotor symptoms. There are other medications also that have been shown to reduce the vasomotor symptoms, such as SSRIs, which is selective serotonin reuptake inhibitor. It's Paxil is one form of it, one of the examples of it. They also use them for depression. So it can also be used for vasomotor symptoms. So don't think that is only for depression. And also gabapentin and oxybutynin. Those medications have been shown also to help reduce those symptoms. There's another drug that's called suvorexan. It's also been shown to reduce insomnia. As we all know, during menopausal period, because of the declining hormones like the estrogen and all that, sleeping becomes a problem for some women. So this medication also helps. Suvorexan was also shown to reduce nighttime vasomotor symptoms compared to placebo in some studies, but it wasn't shown to reduce daytime vasomotor symptoms. So in case we have daytime vasomotor symptoms that are bothersome, we can use the other medications that I did mention. What are the recommended things that you can do? Cognitive behavioral therapy, clinical hypnosis, SSRI. So what if CBT or cognitive behavioral therapy? It's a type of talk therapy that goes deep and kind of recognize the negative thoughts that you might have, and then it challenges those thoughts, and then it helps now give you thoughts that you can use to make positive changes. Like sometimes you might think about yourself and say, I'm not good enough. And cognitive behavioral therapy is going to help you change that thought. And instead of you saying, I'm not good enough, then you can say, okay, what is it that I think that I'm not good enough? And what can I do to help change that? It can only be done by a trained professional to guide you through that process. So, what is clinical hypnosis? So it's a state where a trained healthcare professional would take you into a place where it's almost like you get hypnotized, whereby you focus on whatever they're telling you, and that will help you calm. If in case you have anxiety, it would help calm you down. If you have anything you're struggling with, whether it's pain and all of that, it would help calm you down. It can only be done by a trained professional in hypnosis. What about pace breathing? Pace breathing is a method that you can use to decrease stress. So it helps you reduce the way you breathe, and with that it sends signals to the brain that will help reduce stress. An example can be where you take a deep breath, like 1, 2, 3, 4 seconds, inhale, and then you exhale 6 seconds. What that does, it helps to calm you down. So you can use that also.